We're here today joined with the man, the myth, the legend himself. Ned, how are you?
Alhamdulillah. How are you?
Alhamdulillah. I thank you for coming on. We tried to do this a couple of times, but subhanAllah, if it's not meant to be, it's not meant to be.
Alhamdulillah. Thank you very much for having me on.
No problem. Ned, who are you and what do you do, Mr. Chirokinetix?
Mr. Chirokinetix. My name's Ned, also known as Ned. I was born in America. My parents have been here for over 55 years now.
MashaAllah.
We thought we were going to be living in America.
Wow.
They decided to come back. Alhamdulillah for that decision as well. Studied in Australia, went to Punchbowl Boys.
Wow.
Became school captain over there. Alhamdulillah, it was actually it was a bit difficult, but it was definitely a journey. And went to university, New South Wales, and ended up in my master's degree in chiropractic. And
when we talk about culture on the podcast, you've just touched on culture.
Yep.
That you're from background
Lebanese,
but you were living in America.
Yeah.
And
so
then
my parents were there, and the whole family were over there as well. And
wow.
I was born there, and a couple of years later, they decided to come back.
So your cultural identity is your Lebanese background, your American culture as well, because you were born there with your parents.
Citizens,
yeah. You would have that cultural influence. Then you've brought all that as a family, second generation into Australia, and you've graduated from Punchbowl Boys High School at a time which maybe was difficult compared to now.
In the year 2000, it was probably the most difficult year in
especially with the events that occurred that year for our society. School captain?
Captain.
Okay, and then you've completed your master's in chiropractic. Now, I'm going to dig so deep and, we've had our own podcasts.
As deep as you want, go for it.
We've had many off-the-cuff podcasts while you're treating me, always, alhamdulillah. And I want to tell you, chiros versus physios. Chiros versus physios. What's the war about? Is there a war?
Look, there's a war if you want it to be.
Okay.
That's the truth. Okay, so if you're a doctor, if you're a surgeon, if you're a physio or a chiro, you're going to find, every single person has a different opinion about it. And really, should there be? Shouldn't be. Every single profession has their place.
That's right.
Okay? I'll tell you straight out. If you do an ACL repair on your knee, an operation, why would you want to see me? Why would you want to see a chiropractor?
Wow.
I'll tell you. I'd like you to go and see the physio. I'd like you to go and see the physio because this is their domain and they're amazing at it. Okay, get into the rehab of the knee. Start doing your exercises. Measure. Make sure that you reach your goals post-op.
Wow. And I've done.
We know how to do it as well. Don't get me wrong.
Yeah.
But if I want the best for you straight away, I'll do that. Okay.
And I've done my ACL.
Yep.
And I had seen a chiro and a physio.
Yep.
And I was thankful for that chiro a long time ago. I was 16 when I did my ACL. He did give me that advice.
There you go.
But one thing I've noticed in your clinic, and you've just given beautiful advice, and I rarely hear chiros share that.
Yep.
It's all about themselves as chiros. And same for some physios.
Yep.
In your clinic, if I may say, you've actually built, mashallah, allied health where I walk in there, and if I want to see a physio, he's right next door. If I'd like to see the hijama and the acupuncture guy, he's right there. Then we have the chiro. You've all these so-called wars of allied health. You've joined them together.
Definitely, and it was actually quite difficult right at the beginning. And obviously, depending on who we hired, who we put through our programs, and like I said, every single person has their place. And alhamdulillah, like now we even got pediatricians working, not with us, but like with us for you guys, like for patients.
So I can book a pediatrician.
Well, we can get in contact with them.
Nice.
We've got a really nice network now where the chiropractors are like, because I see a lot of babies, so I am referring on to pediatricians. They're referring on to me. Same thing with pediatric physiotherapists. Even if it means we're referring out, I'll refer you always to someone that's the best in their field.
Wow.
Okay, so if we don't have it, I'll definitely find someone for you. I'll never just leave you in the lurch. And that's what I think what has always been my goal is to make sure that if you come to see me, I will diagnose you properly, which is the most important thing. Treatment is the easiest. Once you know exactly what's wrong with you, treatment is not hard.
Speaking of that goal of yours, I personally experienced it. I'm not sure if you remember. My brother-in-law is a physio. Bam Bam, he was on the show in our pre-launch. Muhammad, you know him. Yeah, and he thinks highly of you as well. When he was treating me, at his stage of his life, career, he was quite busy with his boss. He's got an amazing boss as well. His name's Mustafa, lovely guy. So my lower back flared up at the time, and I was very sporty growing up, and I was out of action. And when it flared up, and he instilled in me, Muhammad, that you don't need surgery. But then when it flared up, it just, the thoughts in your mind. Course, I came to you literally with a broken back at the time, and I worked next door to you. And I hadn't seen you in a long time. And then I still remember the way you handled my case with such care. You were so genuine, so honest, and so calm. And you can tell that my anxiety was through the roof, even though I was hiding.
I remember it very clearly.
You remember it?
Yeah, very clearly.
Can you share that moment to the audience? And I'll touch on that. Yeah. So when you see me, what comes to your mind when you see a case like that where I'm walking slouch and I'm so tired and flared up?
Look, first thing that's always going to come into someone's mind like that in an acute phase is, I don't even know if I'm going to get better.
Yes.
That's right. So and you could see that on every single person's eyes when they walk in there. And they've got that negativity, obviously walking in, like, not only have they left us really to the last resort, but on top of that, they're not really giving themselves an option to heal as well. So imagine the pressure that's on us, right? But we put ourselves obviously in your position very quickly, and we know what's going to make you feel better. We know it's just going to take a little bit of time with some treatment, and most likely you won't need surgery because I've just seen 15 people before you today with the same thing, so you need to be quite confident when you're delivering these words.
Yes.
And I think confidence comes in the language and obviously how we speak to you. And you can see that, especially as a vulnerable patient. And I remember quite clearly how it was. And like I said, you're not the only one that's walked in like that. It happens many times a day.
Well, I experienced your service firsthand, and this is by no means a plug. I felt like I was broken in the acute phase, and I started thinking I was on my comeback trial, going back to sports and training because it was on and off. Yeah. And then after you had that, you've got the booking service is done in a way where I seen a remedial therapist.
Yep.
Yeah, so that just he eased into my lower back and kind of softened the flare. And then when I finally seen you and you did your thing through conversation, I was able to loosen up. And then I still remember I asked you a question, Ned, do you think I'll ever be able to go back to playing sport again, and specifically, let's say, indoor soccer?
Yep.
And then you told me, and that was words of affirmation, and I believed it. My mindset was shaped.
Yeah.
You said you're like a car that needed urgent repairs. You're not broken, but you need repairs. Usually other chiros or physios will schedule in weekly, but your approach is completely different. Can you divulge into that?
Yeah, so like we're not cookie cutters as well. So cookie cutters meaning obviously not the same thing for every single person. I saw a guy just the other day, saw him once. Then I actually, alhamdulillah, I didn't need to see him again. Because the reason why he wanted to see me was for a particular thing, and we sorted it out. There was, it wasn't lucky, it was just one of those things that didn't take long, alhamdulillah, to sort out. And, I gave him the educational talk about how obviously how to look after your body, wellness and that. But at the end of the day, it's up to him.
That's right.
I said, but next time you may not be so lucky that I'll take one visit.
You said that to me as well.
Yeah, exactly. And it's a guarantee on myself as well, because I need you to be aware that, alhamdulillah, we treated it very quickly this time. But also next time, don't forget, you are going to be a bit older. You may not be as lucky.
Yeah.
Okay. And try not to put that much pressure on me to make sure
you can
I do absolutely everything for you and try to get you walking out that door without the walking stick, for example. Inshallah, it happens every time. But, I want you to live the best, and I said it the other day to a patient. Now, if you work for someone and you can have sick days, that's fine. You know, you can afford to have a couple of days off here and there. But usually most people around our area now own their own businesses. So if they don't go into work, who's going to pay them?
That's right.
So naturally they have to be, you know, on the forefront and trying to heal as quick as possible. So why wait for something to happen? Get onto it. You don't have to see me every week. Even if it means just maintain yourself exactly as you would your car. See me monthly. Let me see what's going on with your body first. You may not even notice, but I'll point them out to you. We'll give some adjustments, some nice treatment, and away you go.
Well, you've taken me back to the treatment schedule that you gave me, considering that I hadn't seen you for a long time, and you did the exact same thing. And after I stuck to the schedule, I seen you one more time after that, or a few more times after that, but there was one specific time you said, there's no reason why this is how you delivered it. Your tone went up, and you said, there's no reason why you shouldn't be playing sport now. I said, Ned, but I can barely walk. You said, you're temporarily broken, you'll be healed. And you know what I did?
You played?
I played 6 indoor soccer matches in a row.
Nice.
And my wife was surprised because she's seen the state that I was in. And with the treatment plan you gave me, but I feel like as well, the mindset shift.
Yes.
How do you link the mindset, mental health, the words that you utter with the treatment itself and the treatment schedule?
It is quite difficult. It's not easy as well. So if you can appreciate, like I work with, say, like the WWE team or some wrestling teams and that. Now they come in with severe injuries, not anything nice and easy. Do you think I can tell them you're not allowed to perform in 10 minutes? So, or can you not perform
So
in
this
2
is
days?
backstage live.
Yeah. Or, you know, in 2 days' time, you're not going to be going out to a sold out, you know, event. No, I gotta step up. I gotta, you know, make sure obviously whatever it is, it's done properly, you know, and the advice that I give him is proper. Like, unless it's completely broken, then obviously don't. But there's a lot of ways where people can actually perform with, for example, bad backs and that. But it's a bit difficult to try to explain them. But yeah, it's a mindset game. But as long as we've diagnosed you properly,
yes,
that's what matters.
I remember it was a lower back issue for me, and I initially thought it was my QL, and then you did your testing, and then you said to me, as long as you do 1, 2, and 3, and then you gave me that mindset, my perception changed.
Yeah, you're okay.
That I'm okay, and you ended it like that.
Yeah,
you delivered it like that.
You're okay.
That you'll be okay. And I kid you not, I went home the next week, and like your words of affirmation with your treatment, every time I have a niggle, I'd remember your words, you'd be okay.
Alhamdulillah, that's good.
Alhamdulillah.
That's fantastic.
Yeah, and you did warn me, and you said, look, even though now you feel good, don't wait for the issue to arise. Yeah. Now, how does your field improve one's quality of life? And what's one of the most severe cases where you've improved someone's quality of life and the changes it's had on their life with the lower back?
Yeah. So I'm not sure if you've seen, but I did a case on a guy called John just the other week. He approached me, and John is a Samoan brother. He came in, and look, he spoke. You know, he was really nice and truthful, and he was pretty much, if I could say it in a nice way, he pretty much crawled into my room. Yeah, it was a big boy, crawled into my room. Never ever seen him before, and he just walked in and he said, bro, you need to help me. I was like, okay, let's get on. So, you know, nice and as quick as possible, got through the questions with him. The most important information I tried to extract out of him. And he was actually a mess mentally as well. And you could see it in his face. And obviously it had a lot to do with his back, but I think a lot of it was stemming from something else as well. And this didn't just happen in a couple of days. He's been like this for a while.
Wow.
So it was starting to become quite chronic. which becomes very difficult to fix. Anyway, alhamdulillah, we got some really good results for him. And he mentioned also in the consultation, it was just in chit-chat, that he really, looks up to, I don't know if you know Ahmed Harachi.
Yes.
The Muslim undertaker. And he knew that he'd come in, or he had some sort of an association. We've seen him before, and I said, maybe one day, you'd be able to see him, or, hopefully, like, what would you like to say to him? And he just let out. He was like, and he just let everything out. Tried to commit suicide 4 times. He had a really rough previous history. And so his mental state was not healthy. With
the chronic injuries.
Yeah, and
that put a lot of pressure on him
as well. Added a lot to it as well. And he said that, I just needed to take, he goes, I just want to thank, the undertaker for what he shows us, and he makes me think about everything that I do.
He puts life into perspective.
Yeah, and he wasn't Muslim. This guy, he was just John.
And he helped him out, and he linked him to you.
And he doesn't know him. But long story short, I got Ahmed and came and surprised him. And I actually surprised him into the consult room.
That's when Ahmed walked in. I watched that part. He walked in, he was surprised, and he was ecstatic and elated to see him.
Yeah,
while you were treating him.
And had him. There were a few tears that were shedded, and they had a really good conversation together.
Nice.
And you should just see this guy's mental state, how it just calmed down. SubhanAllah. Obviously, they've got their own conversations having together.
Yeah.
And I think Ahmed's helping him a lot. So
look, that's what's important, that there are voices out there in the community, whether it's Allied Health in yourself or influential people and brothers in the community who are changing people's lives for the better.
Yeah.
Because our goal at the end of the day is one's qualities of life, Yeah. The better your quality of life is, the better life you'll have.
Of course.
And with that comes the Lebanese back. What's the go with I have a disc? Growing up, it's like a stigma that I always hear. Grandparents, uncles, aunties, I have 4 discs, I have 3 discs. How many Lebanese backs have you seen?
Look, if I could put it in a nice way, if I told you you've got the flu, that's in a nice way of saying, but how do you have the flu? What's the flu? Is it a virus? Is it bacteria? Is it COVID? Is it influenza? Is it, how many different ways does a flu present itself? That's pretty much saying, like, I've got a liver back. But when you look at it, it's like, yeah, all right, you've got, no, I did this exercise. No, it's not like that. Please don't Dr. Google or Dr. Abu Salim this. Just
Dr. Abu Salim.
Yeah. Just, make sure you get it diagnosed properly. I know this. But yeah, there's so many different ways of having a bad back. You don't just go off and try to do it yourself. Just do, at least get it diagnosed properly, see what it is. Go to your doctor, go to your chiro or physio, get it done properly. And at least let them tell you what it'll take to sort it out. And then you make the decision.
And a lot of those acute injuries, or specifically lower back injuries, do you feel like they're, how would you describe them when someone all of a sudden randomly comes to you and says, oh, I've done my back?
Yep.
Do you feel like it's a build-up of pressure or neglect, or how would you explain that?
So usually the straw that broke the camel's back, right? So it's...
Great line.
Yeah, obviously you can put so many straws on a camel's back, but it was just that last one and it just broke it. And that's pretty much what it is. Like with backs, you need to maintain it. Same as what I say about your car. Maintain it. Even if you're not driving it, you still need to tune it up. If you don't drive it for a whole year, does it mean you don't touch the oil in it until you turn it on?
No.
Yeah, exactly. You still got to maintain it, put new oil in it. Obviously you fix spark plugs, your filters. The more you drive it, the more you're going to need to look after it. Same thing with your back. Okay, so be nice and healthy, look after it. You know, obviously do a little bit of exercise. You don't have to overdo it. If you're an office worker, get up, move. You know, get used to that. Don't stay sedentary, and you know
the way we're sitting now.
Yeah, but imagine, you know, sitting down 8-12 hours a day.
I can feel it, hips and glutes, right, and lower back.
Yep.
And then tight hamstrings, and then.
Well, that's just a recipe for a disaster long term, you know.
Yeah.
So just honestly, just get up and start moving. I'll tell you something, but with more active people, yes, they'll get more injuries, so they're more prone to injuries, but they'll usually heal quicker.
Active people are more prone to injuries.
Yep.
But they usually heal quicker.
So, for example, athletes, or tradies, you know, wrestlers, if you want to say that, they're more prone to injuries, but they'll heal quicker.
Compared to someone who lives a sedentary lifestyle.
Correct.
Barely moving, or, you know, we all know what a sedentary lifestyle is, lack of physical activity, lack of moving. They acquire an injury, it'll take them much longer to heal.
Correct.
Compared to someone who's more prone, who is an athlete or very active, that's an interesting
but they're less likely to get injuries.
Wow. Okay. Who are these?
The sedentary ones,
You just threw a can of worms at me, because I've never thought of it like that.
Yeah.
And when you talk about wrestlers, just tell me, because through conversation leading up to this podcast, I'm like, let's talk about the wrestlers. And then I find out you have no interest in the sport or the entertainment business. How does someone who has no interest with wrestling, WWE, TNA, whatever it may be, all of a sudden is treating these jacked athletes before they go out and perform? How?
It's you know, I was growing up, you know, it was never my thing. I don't know why it was. And like, it was just the other day, you know, I know the guy's name, Bret Hart.
Oh, Bret Hart.
But if you walk past me, I wouldn't know who he is. And
did you treat Bret Hart?
Yeah. I
wow.
him as well.
Yeah.
But I wouldn't know who he was if he you know, if he came up to me. And Haram, it was only until he came up to me and said, "Hey, I'm Bret Hart," you know, in the American accent and
Canadian American too. Bret Hart. Yeah.
And I was like, "Oh yeah, cool, come in," you know. But yeah, and then I was like, oh, I definitely know that name.
Well, with Bret Hart, he's got the famous Montreal screw job. Did he talk to you about that?
No.
Wow. Because it shows you have no interest. So he had something in the 90s, late 90s with Vince McMahon, WWE.
Okay.
And they purposely called the match opposite what they had agreed. You know how it's all scripted?
Yeah.
They agreed that he's going to win or whatever it's going to be, and he'll leave the company. And then it's a famous screw job. So in front of a packed out crowd, HBK, they purposely, Vince was there too. He called the match differently.
Okay.
And they did 1, 2, 3 quickly. And it's one of the most famous, iconic moments.
Screw job.
They named it the screw job. It took about 30 years to mend ties.
Wow.
Yeah. And then after that, he went to, you can tell I'm a bit of a wrestling buff.
Yeah, of course. I was like, oh, you're teaching me something.
Yeah, well, I'm not going to go there because I'll go on a tangent. And then I've seen that you treated, I think, Dolph Ziggler.
Yeah.
And
nice
John
guy.
Morrison. He's Jack.
Yeah. So it's, and they all come from, you know, I can't keep up, you know, WSW, TNA, and WWE.
Yeah.
They've I don't understand now. What is it?
WWE is a major, the number one company.
Yep.
They've now collaborated with TNA.
Yep.
So they're working jointly together now. And it's in the industry, it's something that was a shock.
Yeah.
So I've seen once you had, I forgot his name. He's on TNA. He was jacked, and then you were telling him that I think it was his leg.
Alex Hammerstone.
Alex Hammerstone. Yeah. How was that experience?
Oh, he's a nice guy as well. Yeah, he fractured his ankle.
Before going out, or
no, on stage.
On stage, is that what it was? And then you lifted up his leg doing a mobility test.
Yeah, and he had a massive round the next day. I'm just trying to remember, what was it? So I saw him in Ballarat. The next day, no, Penrith. Sorry, and then the next day he was the main event.
Oh,
yeah, and alhamdulillah, we got him to a point where obviously I couldn't fix the fracture, but got him well enough that no one would notice, so no public would notice, and he performed.
You watch him?
Hey?
Did you watch it?
It was amazing.
Oh.
Yeah, so...
You've seen the fruits of your work on the athlete who had to
it
walk
was
in.
obviously like him, the way he reacted, and obviously, he thanked me for...
Yeah.
And that's obviously that, it makes a big difference like that, yeah. So obviously I couldn't fix the fracture, but got him well enough and got all the other structures working well enough that, he could perform. But I was like, just don't blame me if it completely breaks open.
Well, you are a man who was born in America, then graduated from Punchable Boys, school captain. Then all of a sudden you're treating wrestlers. Did you ever think you'd be doing such a thing?
Look, it's to be honest with you, I absolutely love treating the wrestlers. So I enjoy them more than even like my sporting teams and like the high profile teams. Like, don't get me wrong, I love seeing absolutely everybody, but they've just got this, and they're just nice guys, I can really relate to them, and maybe because I'm not starstruck as well, I feel like with them, and I think they probably like that. Yeah, and then you're not asking them about what happened here and what happened there. I'm just like,
they get a lot of the wrestlers in their fan base is so fanatic, extremely fanatic. So when they have someone like you who has almost no interest in the sport but is there to help, they can wind down and relax. They don't have to be in character, because there's a famous word in wrestling called kayfabe, where they need to they stay in character all the time to maintain their character. So when they're probably with you and behind the scenes, they're just themselves.
Definitely seem completely different.
Completely different. So you go from treating wrestlers, and I've seen that you were with, who's a lovely guy as well. Unfortunately, he came short, Yui Dib.
Oh, yeah.
So how do you go to treating boxers?
No, like, alhamdulillah, like with Billy and Yui, and I think I see Munir and a few of the other guys. No, it's the same concept. Okay. So a lot of what I see are just pretty much instant pre-game.
And is it more torso, upper back with the boxers?
With boxers, it's all, most of it's upper back and pelvis. Obviously just depending on their stance and previous injuries as well. So, but we try to get them as good as possible, literally to the minute, just before. And I enjoy it. On me?
Yeah. No? MashaAllah.
No.
So you're practicing, or you're doing your craft on a boxer just before he steps out to the ring?
Literally to the minute, yeah.
Is the treatment different to the lay person, the normal person?
It is a little bit different, yeah. So, but you got to remember the adrenaline that's going through them as well helps me a lot. And, we got the vibe going, in the rooms, and it's a game changer as well. So, and I take advantage of it for their purpose. And alhamdulillah, like it's
were you with Billy during his charity match?
Yeah.
Oh, how was that seeing? And he will be a future guest on the show. We're in regular contact.
He's a gentleman.
He is, yeah. He's a champion, Billy. He's waiting to go on the show. Yeah. Subhanallah, but we've both been busy. How was it with him during his journey, making that comeback after we all know the publicised journey that he's been on?
Yeah, look, you're talking about the one that just happened in Wollongong.
The charity match. Yeah.
Well, alhamdulillah, we were lucky enough that he invited myself and my wife as well, and to go down with him. And look, he didn't publicise it a lot because he didn't want the attention to be on him. And I obviously asked him that question, and he's like, "No, let's just try to keep it maybe a bit on the down low," because obviously the charity that he was doing was very local over there, and he didn't want it to be about him. But yeah, and he's been practicing, and he's been training, and he's been doing amazing. And alhamdulillah, like from what he's been through and what he's doing today, was like nice. And that speech that he made right at the end just blew everyone away, and especially the way he walked out, in the middle of Wollongong, and with the the Palestine robe, and
well, his mother's Palestinian, right?
Correct.
Yeah, so it hits home for him, and we ask Allah to ease the hardship on the suffering of those who are living right now in Palestine. The cause that he's fighting for is huge, especially that it's so personal as well, and everyone plays their part. So did you treat him before that return as well?
No, not at the game. No, I treated him privately.
Okay, awesome.
That. So, but yeah, not during the actual. So it wasn't. It's more like a. There were a lot of amateur fights as well during that.
So it's also pushing the card, helping the amateurs,
yeah.
giving them the spotlight as well. Yeah,
so
excellent.
It was a pretty cool day actually. It was really enjoyable.
I'd like you to go deeper in terms of localized or isolated injuries.
Yep.
What's the most common injury that you see happens to young men in their 20s, specifically those who go to the gym and try to lift that heavy weight initially, and then they come to you with a bad shoulder, bad back? What are common injuries that you feel?
So obviously the most common I would get is someone that's got bad form with a deadlift.
Yeah.
So it's definitely the most common. They're actually the easiest to deal with if you approach it very quickly.
So deadlifting, if done correctly, you have no problem. But do you feel like the slightest movement during the deadlift can cause chronic back pain or
acute back pain?
Acute back pain,
So it can flare up something that's been there. So technique is definitely very important. So that's what we always recommend. Obviously make sure you try to get your technique correct. Don't just go off what your friend is saying. Make sure, seek maybe a PT at least.
I'm laughing because it's so common. I've been training on and off for such a long time. Don't go off what your friend is saying. It's so true.
Of course.
Lift more. You can go heavier. Arch your back at the, what do they call it? At the peak. Yeah. Or stick out your bottom at the back.
Stick out your bum, yeah.
Yeah, but then when I watch, Athlete X.
Oh, yeah.
Yeah, when he breaks down deadlifting, for example.
Yep.
He's explained, and correct me if I'm wrong, that maybe arching your back will work for you, but with my body type.
For everyone, that's right.
Yeah.
Yeah.
So can you go deeper into that?
Yeah, so, arching your back creates a lordosis, right, which is like the, that's where you can put your hand in that curve. Okay, so most of the time that's actually a good thing. Okay, but sometimes you can have an excessive lordosis. Naturally, you could just be like that. They're the ones that kind of walk around with kind of like their bum sticking out.
Yeah.
And you do have a greater incidence of getting lower back pain as well when you have too much of a lordosis. But you also have a bigger incidence of getting back pain if you have too flat of a lordosis. So where you don't have enough curve. And that's more common though, okay? So, and that's where, like what you're saying, something for you could be good, but not good for me. So that's why it's important that you do seek at least a PT when you're there, at least the first time. Get him to show you what it is, how to do it correctly, and go from there.
What if he tells you, I self-teach myself?
Who says that?
The young guy in his 20s who just watches online and goes to train.
And that's fine, and most likely it's okay as well, but are you gonna try to risk it for that once?
Would you say deadlifting is a dangerous workout?
No.
Contrary to popular belief?
Definitely not. It's actually quite good for your back if done correctly.
If done correctly?
If done correctly.
Squatting?
Yeah, same.
Okay. Is there any workout that comes to mind that may be dangerous? Or do you feel like most of them, if done correctly, are good for you?
Most of them done correctly, yeah. Look, it's all resistance type of training is really good for you. Swimming, if I could say, is the absolute best.
It's the pinnacle.
It's the pinnacle of any type of exercise for anybody. And if absolutely anybody.
If on that note of deadlifting, I feel like it's such a popular exercise amongst men, women, youth. What do you recommend are cues that someone can take, just quick cues that they can watch this snippet or show and feel like they can take from it to help them with their deadlift?
So, like I said, get your form. You can, 80 to 90% of people can follow the basic form. Start it with just a bar. Start with just the bar. Get that form proper. When you're going down, you're going back up. Make sure that you can do it correctly, and then start adding on your weights. Okay. Majority of the time when people come into my rooms from a deadlift and they've heard a pop. Yeah, it's actually a pop.
Oh, wow.
And they've lifted too heavy at the wrong point. That's it.
Would you say the wrong point would be in the halfway mark?
Usually
going
yeah.
up.
Yeah. So it's definitely
Is that the flexion stage?
Yeah.
Yeah.
So and sometimes it could be just even when they're trying to put the weights down.
Yeah.
After they finished everything. Yeah.
They loosen up too early. Okay. And another thing that comes to mind with training on resistance training is a lot of people strive to squat, and is it the peak at the bottom where the famous bums to the floor?
Well, if you can.
If you can. But do you have to go all the way down?
No, you don't have to. No.
Yeah.
So the good ruling is obviously until your feet your heels start to come off.
Yeah. That's a nice cue.
Yeah. So what I try to teach my guys is feet flat on the ground, back onto the wall. Try to keep your back flat on the wall as you're coming down, and you stop as soon as your heels start to raise.
See, those were the cues that I was trying to divulge into, and you've just hit the nail on its head. Yeah. Easy, simple cues for the person to understand. And as a chiro, do you prescribe training exercises to your patients as well?
Look, yeah, we usually do. My focus is obviously pain, because a lot of people come in and see me with a lot of pain. Yeah. I'm not going to sit here and tell you to do exercises straight away. Okay. That's the truth. I just want to get you out of pain first. If I can at least get you 80% out of pain, and then I'll start giving you exercises to get rid of pretty much the majority of the pain that's left. And then your next stage of exercises would be to try to prevent it from happening again, or how to strengthen it as well. We'll stretch the right muscles and strengthen the right ones.
Well, as I said earlier, your business model that you've set up is contrary to popular belief. Compared to other chiropractors out there. You've got the two wars of physios and chiros together, multidisciplinary. And one thing that I did like is that how you've incorporated the remedial massage before seeing you. So I feel like it was such a, I don't want to say luxury, but it was the vibe and the tone that you've set with your business model. I seen the remedial massage, I got what I really wanted, that deep tissue. And then when I come and see you, I'm not worried that I'm cold.
That's right.
Do you purposely do that?
Of course.
Okay.
So, and my massage, they're all remedial massage therapists. So they're all fully qualified remedial therapists. They're trained how to pick up on red flags, which is obviously very important. So the majority of the time as well, everyone's scared, or they're like, "Oh no, can I see Dr. Ned first before you touch me?" Which is fair enough.
I've said that first because I didn't know what I was in for.
Of course, but they're definitely qualified enough and trained enough to pick up on red flags. And if it doesn't look happy and healthy, and which is rare, that they can't touch it, then they'll say, okay, maybe doctor should see you first.
And on your team, one thing I did notice, and I've worked with a range of teams, you've cultivated such a positive working environment where they also are very hardworking. And you mentioned once a comment to me that this is a positive environment. Everyone's happy. As a leader, how important is it to cultivate a positive working environment where there's no toxicity amongst colleagues?
Yeah, look, it's exciting. Honestly, it's actually really exciting. From the time I leave home, or from the time I leave mum's house to the time I want to get into work, I don't feel like I'm going to work. Wow. I feel like I'm actually going to see my friends. That's the truth. And when I know that I'm not comfortable to go into my own workplace, I know something's not right. And I know that there's a cancer. And I actually, everybody knows me, but I admit the cancer very quickly.
I wouldn't say that time there was a cancer, but I remember when we had that comment, you felt something was off, and then you just made a nice, sharp comment, and then everyone was onto it. And then you told me that even though we're about positivity, that I am driven to make sure the standards are high.
You'd have to be, And look, alhamdulillah, we pride ourselves on that as well. I come from a really big customer service background, so I'm trying to change the way health is seen. You're not going in and seeing this guy, it's like, here I am, I'm a chiropractor, or I'm a physio, you need to listen to me, Yeah, all right, listen to me. And there's obviously boundaries, but at the end of the day, it's about customer service as well. I'll say the word customer because at the end of the day, you are a customer as well. You're a patient, you're a client, You're a customer. You need to have that service behind you.
Mm.
Okay, so we need to make you feel heard. And yes, you are always right in regards to the service that you're going to get.
Mm.
In terms of the information that I'll be giving to you, I'll be right.
Mm.
And there's a difference when it comes to that. So I want to reshape the way health is seen and portrayed. And I don't want people to be scared when they go and see a health practitioner. Communicate. If you don't like what you saw or don't like the way you got treated, communicate. And alhamdulillah, you know, obviously I get a lot of communication feedback. I'm big on that. I'm very big on follow-ups with my patients, and with every other patient that comes in, we're always following up on what happened, how'd you go, do you have any feedback for me about this service and this service. And look, you know, sometimes you get really good ones, sometimes you get some really good feedback about how constructive as well. We try to take that on.
Alhamdulillah.
So, alhamdulillah, so it's important.
In terms of communication and feedback, I would like to communicate to you now that I'm grateful and thankful that you've joined us on episode 3 of the Chronicles of Faith.
Thank you very much for having me. It's been amazing.
The pleasure is all mine, and I mean that from the bottom of my heart.
Thank you.
And I look forward to later on in the show to bring you back to focus on more specific injury-related issues and pain management, tablets and versus treatment.
I'd absolutely love to do that.
And just to help the audience, because you've mentioned something just now, and I'll tap into it quickly, that you have a goal and a vision to change and shape the health industry.
Yep.
And I felt that firsthand when I came to your clinic. So, Ned, thank you for coming on the Chronicles of Faith.
Thank you very much.